Welcome back, I'm Suresh Machu from Machu Tattoos. So as of now, these many days we have done a different episodes for tattoos, and many of the clients asked us in the social media, we want to know the details about the piercings also. So from now on we are going to add the piercing also in our episodes. So today the topic is how to get rid of piercing blisters. It's the most common problems most of the people face at the time of after piercing. Within a 1 week or 2 weeks these blisters may happen. In this video I'm going to completely explain about why this piercing blisters happen and what are all the types are there and how to find the relief for this. Let's get into the topic now. When we talk about this piercing blisters, there are three types of piercing blisters are there. The number one type is abscesses, and the number two folliculate cyst, and number three hypertrophic scarring. So first we need to identify which type of blisters you are having in your piercing place. Another important thing is placement. Placement also plays a key important role when it comes to piercing. In your body where you are going to get that piercing done depends on that the blisters varieties also may get vary. I'll talk about those three varieties. First, abscesses. Abscesses blisters are nothing but there are a infectious liquid which will be formed under your piercing hole. Because of this infectious liquid under that, it will be start to create the pus around the pierced place. That will be caused as a blister. So, second type is folliculate cyst. Folliculate cyst scar happens because of the dead skin or the hair pores in between that, or else pores clogging because of this metals which we are going to pierce on that particular body part. Due to this folliculate cyst scars may happen. So this blisters also we need to be taken care of. You no need to worry at all. It will be healed quickly. I'll be talk about the healing in this video in the continuous ways. Then the another third important thing is hypertrophic scar. Hypertrophic scar is the most highest level. That means it can't be treated very quickly. It takes so much time to get healed. Hypertrophic scars mostly happen because of the damage of that particular skin. This damage may cause because of the metal quality or else piercing into the nerves. So hypertrophic scars, and many people think this hypertrophic scar is the keloid scars. No, this blisters are completely different from the keloid scar. This is not the keloid scars. This blisters obviously it will be goes off. You no need to worry at all. This keloid scars it will be stars remain on our life. So this piercing blisters and keloid you no need to compare with that, and you no need to worry about it. Now let's talk about how to find a relief for this piercing blister. So when we start to find the relief, the first most important thing is when we do the piercing, we are making our body to be think that this metal is going to be is one of our body part. So just let get adjusted. That's what we are doing it, correct? So when we do this, you obviously needs to give a time for the body to get healed. Yes, if you did not give the time and if you just keep irritating that particular place or touching it or trying to scratch it or giving more stress on it, obviously that will cause the blisters and that will cause the infections. These things you need to understand very clearly. And then the second identifying the relief is identify the irritant. Yes, you need to identify you are having the blisters on top of the piercing place or the inside piercing place. Got it? So if you are a person got a blister on top of the piercing place, then what you should need to do is just keep that place clean as much as possible. That's cortisone may happen because of the trauma around the metals giving a more stress on that particular place. So just clean that place and make it as much as moisture. Nowhere let it get dry. This may cause more itchiness for you. So never let it get dry. So another thing is if you are getting a blister inside of the piercing, for example, you are getting a blisters on the back side of your ear. If you are getting ear piercing, then what you should need to do is you can't see that until unless you'll start to get a pain. So this mainly happens because of wearing a tight dresses or tight helmets around it in your face, or putting a pressure while sleeping on that particular places, so you need to avoid that for another at least 10 to 15 days. If you do that, obviously that inner blisters will be goes off. I'm just telling you the different ways of healing this process. You can try any of this, surely this will be work out. And then the third important thing is check out the jewelry. Which jewelry you are going to wear in that particular place, and what's the nature of that jewelry metal. So in our studio we are using a titanium coated 304 surgical stud, that is the stainless steel. So your stud should be stainless steel titanium coated one, or else titanium coated surgical steel it should be. If it was there, it will be help you to heal quickly and it will not cause any infection. But if you are a person getting it from the normal low quality steels, or which is not approved, which is not sterilized much, then there is the chance of blisters may come. So for this you need to check out your professional piercing artist, and you can ask them the questions what and all you having it, so they can help you out with this, what is the metal you are using it, and they can help you out with the best professional piercing studs also. In our studio we are doing it from past 6 years, and we do both the things, even needle shots also we do, even the gunshots also we do with the completely sterilized procedures. Each sterilization process will be taken each and every clients at the time of piercing in front of their eyes itself, so you needn't to worry at all if you are getting it done from our studio. So now we have tried all these three things to find a relief. If you could not able to find a relief, and if you did not feel that blister is got reduced, then now the things what and all I am going to tell as a home remedies which can help you more to get rid of this piercing blisters. So number one home remedy is change the jewelry. Yes, that's the most important thing. Change the jewelry. If you feel more pain, I highly recommend get rid of the piercing, let that to be healed completely, give that time, then bring that piercing to your studio. They can do it again back with the perfectly. So you no need to worry at all. Just get rid of it. Just forget the piercing for some days. Let that to be healed completely, because healing is the important thing, or else this will haunt you till longer duration in your life. And then the second best home remedy is tea bags. Yes, tea bags will helpful for this a lot. So what you can do is just bring a hot water, put a tea bag on dipping it, and just put a tea bag on the front and the back of the piercing with the hot nature. So this will hot nature will be makes the blister to be heal, and it will be start to soothe them. So it will be start keep changing it. First your blister will be turns as white in color, then that blister will be turns as a purple color, then it will be turns black color as become a scar, and it will be fall off. So this is one of the best remedy you can do it. And then the third home remedy is apple cider vinegar. Yes, if you can't try with the tea bags, then you can use this apple cider vinegar treatment. What you can do is take a cotton and put the apple cider vinegar on it, just same way you just pat it and dry it. As I said to you earlier, that blister will be fall off by the stages of white, purple, black and scars, and it will get fall off. Yeah, but it will take time. You need to do it consistently on a daily basis, at least 2 or 3 times. When you do this, you can get rid of your blisters. So the last fourth home remedy is, if you can't able to find a relief on all the 3, then you can choose this fourth remedy as an option. Because this fourth remedy, you can go to the dermatologist, they will be use the cortisone cream. That cream will help the blisters to get reduced. But another important thing is, if your infection is not gone and if still infection is there, then there is the chance of blisters may come back again. So that's why I highly recommend this as a last option. Just try the first 3 things, surely you'll be get the best output. If you couldn't get it, then you can go ahead for this. This last treatment I'll be highly recommend for the people who are celebrities, who are actors, who want to get rid of their blisters immediately, then they can go ahead. If you are a person working professionals, then I highly recommend all the 3 remedies. Slow by slow, surely your blisters will be goes off. And then the another important key tip bonus here is keep your sterilized piercing place. Because if you are not sanitizing the piercing place properly, obviously that will be cause a lot of infections. For example, in the new piercing place, it's completely new on your body, so you can't keep giving the awareness for that. So if you touch on the place, keep on from your hands, surely infections will be get into your piercing place, because that's the new open wound. So chances of infections will be high. So you need to be very careful in that stage. Last but not least, the last most important tip is while sleeping, if you are getting it done from the body on the time of sleeping, just be very careful. Don't give pressure on that particular place. If you give more pressure, that will be create a trauma and it will be cause the cloggage, and that will cause the blisters obviously. So please take care on your piercing. If you want to check out our jewelry, you can come to our studio. We have a lot of portfolios. Our portfolio pictures we have attached in our Instagram. Instagram link is there in the description, so you guys can go through. Don't die nude.